Assalamu alaikum. Today I would like to explain you about the ventricular preload and afterload, and we will be discussing the detailed features of this ventricular preload and afterload. So first of all, I will draw this diagram. Let's suppose this is the atrium and this is the ventricle. So when the blood is drawn from the right atrium into the right ventricle, so what happens that this blood exerts the force on the walls of the ventricles. So these ventricles, the walls of the ventricles become stretched. So tension develops in these ventricular walls after the blood is drawn from the atrium into the ventricles, and the blood exerts the pressure on the walls of the ventricles, creating the tension. Now more would be the blood, more amount of the blood, so more would be the pressure created. You must need to remember this information, that more amount of the blood that would be drawn from the atrium into the ventricles, the more would be the pressure that would be created on the walls of the ventricles, thereby creating the tension on the walls of the ventricles. So now discussing the further more information about it. Now more amount of the blood, more blood more would be the preload, more would be the preload, and more blood, more would be the preload, and more would be the contractility, more would be the contractility. You must need to remember this information as well, because what is happening, that more amount of the blood that is coming from the atrium into the ventricles, it would develop more preload, because it would be developing more pressure and force on the walls of the ventricles, creating a tension in the wall of the ventricles. So more would be the blood, more would be the preload, and more would be the force of contraction. So there would be the more contraction. The ventricles would contract with more force, because there would be the more blood that is being drawn from the atrium into the ventricles. Now we would like to talk about that what are the factors which determine this preload. Definitely the factors which are influencing the inflow of blood from the atrium into the ventricles would definitely affect the preload as well. So let's discuss that. If the heartbeat is greater, so let's discuss that if the heart rate is greater, so what would happen, that if there is more heartbeat, so definitely the diastole would be less, and there would be less time available for the ventricles to relax, so less blood would come into the ventricles, so ultimately the tension would be the preload would be less. So this is the important factor you must need to remember, that what would happen, that if the heart rate is greater, so there would be the less time available for the ventricle to relax, so the diastole would be less, so less blood would be drawn from the atrium into the ventricles, and the preload would also be less, and the stroke volume would also be less. So if the heartbeat is low, now discussing the another scenario, that if the heartbeat is low, so there would be the more time available for the ventricles to relax, and the more amount of blood would be drawn into the ventricles, and there would be the more preload. So that is the information about the preload. So after the preload, we will discuss the afterload. So afterload is comparatively easier to understand as compared to the preload. So let's discuss. So now the blood is inside the ventricles, and it is creating the pressure on the walls of the ventricle, and as a result the walls of the ventricles are in the tense phase, or you can say the tension has been created in the ventricles. So now discussing the afterload. In the preload, we have studied that the blood was exerting force on the walls of the ventricle, and there was tension developed So you can say that the more amount of the blood, the more amount of, there will be the more preload and there would be the more contraction. So in the case of the preload, now the blood is not ready to move out of the ventricles, and also the walls of the ventricle are in such a position that these walls are in tense phase, not relax phase. So these walls of the ventricle are in such a position that these are not going to be in relax phase. So walls of the ventricle are in tense phase. The tension the tension is present in the walls of the ventricle, and also the blood is also exerting the force in the on the ventricles. So these two, blood and the walls of the ventricle, are in such a position that these two are creating the resistive force, so that the blood cannot be propelled out of the ventricles. So there must need to be the force, the greater ventricular force, that can propel this blood out of the ventricles. So I would repeat again that this blood is exerting force on the walls of the ventricle, and this walls of the ventricle are also not in relax phase. These walls of the ventricle are also in the tense phase. That's why the resistive force is being created, and the blood is not going to move outside the ventricles until there is a force, there is a larger ventricular force that would be exerted in order to they pull this, or you can say propel this blood out of the ventricle. So that's why the ventricular force which is being exerted is always greater than this resistive force in order to propel the blood out of the ventricles. So this is the afterload. Afterload is that the blood is exerting force on the walls of the ventricle, and the walls of the ventricle are also in the you can say tense phase, or these are also in the stretch phase. So this condition, this is the afterload, and afterload prevents the blood to propel out to propel the blood out of the ventricles. So there must need to be the greater magnitude of the ventricular force in order to overcome this afterload and to propel the blood out of the ventricles. So that was my basic lecture on the ventricular preload and the afterload. Hope you have understood it well. Last but not the least, don't forget subscribe MS Lectures. Thank you.